Happy
Halloween!
Welcome to our first episode of Clits and Coffee.
Yeah, I'm so excited. This is going to be great.
Yeah.
So I'm Melanie Milstein. I'm a physical therapist and treating pelvic floor. And yeah, we're really excited to share some information about the pelvic floor.
Yeah, I'm Zoe Paul McPherson, also pelvic floor PT, and we both do CrossFit. We like working with athletes for sure. So just excited to kind of get the conversation started on talking about pelvic floor and keep it pretty casual.
Yeah. So what got you into pelvic floor PT?
I feel like in looking back on it, this made a lot of sense, but I had no idea at the time. I was working with athletes primarily in outpatient ortho, and as like a nice new grad, I was like, I'm gonna screen every person with low back and hip pain for pelvic floor. So I screened every single one, and I asked incontinence questions and bowel and bladder questions, and people said yes a lot.
Yeah.
And like
true.
The tipping point was I asked any changes in bowel or bladder function, and someone said no. And then I saw them on their second session, and I was like, I feel like they probably should have answered yes. And I was like, do you ever leak when you cough or when you sneeze or when you laugh? And she was like, yeah, actually it feels like everything's just gonna fall out when I do that. And I was like, I just need to take a class because this person, like, I'm not doing a good job screening, so let me figure out what I need to do so that I can screen better. And then I wound up just liking pelvic floor.
You know that the question of do you have any bowel or bladder issues, I feel like so often it's just overlooked. You ask it, and then most PTs, they don't want to get into that awkward conversation of what if they say yes and what do I do with it? I feel like oftentimes people think of that as PTs might be like, oh, that's a red flag, that's scary. Instead of looking at it as this is something I might be able to treat, I might be able to help this person with some bowel or bladder issues.
Yeah.
So yeah, that's great.
Or at least like know where to send them.
Right, exactly.
And not be uncomfortable having uncomfortable conversations.
Yes. Or asking a follow-up question. Instead of do you have any bowel or bladder issues, going in a little bit deeper, do you leak when you cough, sneeze, or laugh? Like that can open up the door to other conversations that the patient maybe didn't know you would be able to help them with.
Yeah. So I think that was like, it was pretty powerful, like the percentage of, especially females who said yes. I was like, I know that pelvic PT is booming, but clearly not enough because so many people don't know about it.
Right. Very true.
How did you make the switch after like being in ortho for a long time?
It's always been something that I've been interested in. And it kind of happened. It was a really crazy switch. I had another PT, a pelvic floor PT at work, and she was going on maternity leave, and we needed a PT to be able to take over her caseload. And I was like, well, something I've always been interested in. Maybe this is my door for this to open up. So took some of the courses, and I enjoyed it. And then when she went on maternity leave, my caseload switched to 100% pelvic floor, and I fell in love. It was amazing. It was almost the missing piece of my orthopedic patients. You know, there were so many things that even with my orthopedic patients that I think I was missing because I didn't have the knowledge and the information of how the pelvic floor can influence orthopedic conditions or vice versa, how an orthopedic condition can influence the pelvic floor. So yeah, it was a really natural course, the way that it all worked out, but now I am really enjoying my time of diving into this different field of physical therapy.
Do you think that like going into ortho and only having like the training that you had from PT school, do you think that even as a physical therapist, you were given enough information to like actually screen people before you took a course?
Not really, no. I think, I don't think I even had, I think I could ask some questions. I think I could give, a screening questionnaire. But I think that I did need some more information and some more tools on how to help pelvic floor patients. Because I think prior to that, like it was just Kegels. Like that was really the information that I had. Like I didn't have this other side of things where a lot of people actually get worse from doing a pelvic floor contraction. But prior to starting to actually learn and starting to actually work with patients, I didn't understand why somebody would get worse with just that basic information.
Yeah.
If that makes sense.
Did your school go into pelvic PT at all, or was it like a day?
We had a day. We had one lecture, one day, and I remember actually really enjoying the lecture, and it still stands out to me, but that was all. That was all we had. I mean, this is 10 years ago, and I think, is it getting better? Do you feel like there's more training during school now?
So I thought there was, and that was why I think like when I was asking all these questions, I was like, of course I'm going to screen every patient and then know like, oh, this is pelvic floor, like go see this person. Like, and it got to the point where I was like, no, I just need to figure out how to treat this on my own. And I was like, why doesn't every PT feel comfortable, like at least having this idea?
Yes.
Because GW, we had a 2-week course.
Right.
It was separate from ortho that was specifically pelvic floor. So I felt very comfortable on where to send them and if they were appropriate for that. I didn't know how to do internal stuff, but a lot of the questions and the follow-up questions,
yeah.
like I felt like they did a good job. But then when I went to take the first continuing ed course for pelvic floor, I found out that like a lot of other people did not have that experience. And it's like, no wonder PTs feel like I can't treat pelvic floor because they literally have had no training. And I'm like, no, you could do some of this, you'd be fine. You don't need internal.
Yes, I do. Like my colleagues, the instant they think that there is a pelvic floor issue, they're like, oh, send them to Mal, and that's fine. But I think there are very simple things that we as PTs should have that basic knowledge of, where you can get somebody started on something. Especially because, a lot of pelvic floor PTs, there's wait lists, it's not like you can get in the very next day. So I think even just having some of that, like, simple and basic education where you can at least start somebody on the appropriate stuff, I think is very important, and I hope is starting to kind of make the turn in just general PT.
Yeah. So, I guess with that in mind, we can talk a little bit about, what pelvic floor PT is, what the pelvic floor is, I don't know, something along those lines, and give an opportunity for learning.
Yeah, for sure. I like to think of, if we just localize the pelvic floor, we are talking about the muscles that are going to be supporting our bowel, bladder, and sexual function. But even though that's the localized viewpoint of it, so many things can influence the pelvic floor. So everything from, if you have a previous hip or knee injury, that can influence how the pelvis is interacting with the rest of the system. Your breathing mechanics are going to influence the pressure that goes into the pelvic floor. So, that can lead to different types of conditions like prolapse and incontinence. And there's so many things that how your body breathes and braces that can change what's going to happen at the pelvic floor. Your nutrition is going to influence what happens at the pelvic floor. Your stress, your anxiety, all of those things can play a role into you potentially having symptoms that, like leaking, like heaviness in the pelvis, like pelvic pain, that can be felt at the pelvis, but it might be coming from a different source inside your body.
Yeah, and so some common things to treat: pelvic pain, prolapse, incontinence. But when we say pelvic pain, pain with sex, pain with penetration, pain with OB exams, ability to use a tampon. You do a little bit more male pelvic floor, so I'll let you chat about some of those symptoms.
Yes. I think a lot of times people think of pelvic floor for females only.
And postpartum only. They're like, oh, I haven't had a baby. I don't need this.
Right,
this doesn't apply to me.
Yes. But everyone has a pelvic floor, including our male-bodied individuals. And men can experience things like scrotal pain, penile pain, erectile dysfunction, and even those areas of pain can influence potentially sexual activity. They can deal with incontinence if they, particularly I see a lot of people who have had prostatectomies and dealing with the symptoms of incontinence after surgery, the symptoms of erectile dysfunction, something that's going to change their life forever. And a lot of times they don't talk about it. They are scared to talk about it, and they don't think anybody can help them. But they still have the same muscles, the same system interactions that they can treat and potentially get better. Might take some help from other medical providers as well, in addition to some of the things that I can provide. But yeah, and I mean, kind of the same thing, like for example, if we're going into like scrotal pain, things like your hip flexors, your abdominals, tightness through that area can actually refer down to the pelvis. So it's really important for males and females to do that, full body exam and look at the patient as a whole to see what things might be influencing the pelvic floor.
Yeah, I mean, it like is the gap, or it bridges the gap between the leg and the core and that like interaction. And so like even with my patients, the way that I explain it, and like props to, I think it was Nicole, I'm forgetting her Instagram name, Kozian, who like talked about the pelvic floor like a trampoline. And as a former gymnast, like that like spoke to my soul, because I'm like, I think that I could have pictured it much better early on in PT school if someone had described it like that.
Yes, I agree.
And so,
give that analogy. Give the analogy. I love that analogy.
If you have a trampoline, and we're talking like a big one, like as a kid, you got the net around it. Maybe that's your core.
Okay.
At the top, but right, like it's like a 10-foot trampoline, and if you're picking a place for that to go, like you need it to be a stable ground.
Yeah.
And so you're not going to put it on a hill, and then you also want to make sure that when you put the legs of it together, like they're stable. They have something to stand on. So that's your feet and your legs and your hips, and those make up that stable base of both the ground and the legs of the trampoline. And then you have the springs, and those are the ligaments. They can be really tight and taut, or they might be stretched a little bit. And then the springs attach to the mesh of the trampoline, and that can be really tight and taut or a little bit stretchier, and all that influences how it works. If you have a lot of tension in the springs and you go to jump, you're not going to have a lot of movement, right? Like it's not going to do the job of a trampoline to get you to be able to jump and have fun.
Yeah.
And then if there's too much give in either the springs or the mesh, now it's this kind of slow, big movement where you're feeling a little bit like, oh, might I break this?
Yeah, definitely.
And so we can't always change all of the things, but it's a whole picture of like, if the ligaments have a lot of stretch in them, we can influence the tension in the pelvic floor and the stability of the legs.
Yes.
So like looking just at the pelvic floor would be like trying to figure out why your trampoline isn't working and only looking at the mesh bed.
Yeah, definitely. Well, and I also like that analogy to think of, that like different pressures are going to exert different bounce, so if you bounce really hard, you're going to get an opposite and equal reaction. So same thing, if you just do a soft bounce, that trampoline should meet you where your body's at. So that goes into, things like maybe like over contracting or something, where then you're not going to have as much of that give that your body needs, or maybe your support system is, I don't want to use the word loose, but maybe it's giving too much, then it's not going to give that support back the other direction. So yeah, I really like that analogy to kind of think of the way the system should and can work, and then when there are dysfunctions, where can we make some changes?
Yeah.
Is it at the lower extremity? Is it at the core? Is it a breathing strategy so that we can improve the bounce of the trampoline?
Yeah, so I like that analogy and like summarizing why it's so important to like look at everything and how it works. But then also like you have the image of like the organs are kind of someone on the trampoline. That's what's putting pressure on it. And like you need to be able to have it lengthen, right? So the conversation coming back to like why Kegels aren't always the option.
Yeah.
If things aren't working because there's no movement, like we need to allow that lengthening, or you literally can't absorb that force well.
Right.
And that's when you might start like hearing the trampoline legs kind of shake a little bit, because your legs and your lower body is taking all of that impact.
Yes, I love that. And then so like going forward, what kind of things do you think would be really great to talk about in maybe a future episode?
I think it's easiest to like bias what I see every day, which is a lot of things with like exercise and pain with penetration. Like I personally feel like people come in with exercise incontinence, but then we go down the screening and I find out they have a history of pain with penetration,
Right.
but they didn't know that was something they could work on. So I feel like those two go hand in hand.
Okay. Yeah.
But maybe some like pregnancy and postpartum stuff that's pretty common and out there. I'd love to talk male pelvic health.
Yeah, I think that's great. I think, yeah, or even just, we could do things on just specific exercises and common patterns that we see in patients and stuff. Yeah, I think that's going to be really exciting.
Yeah, and like what the heck a pelvic PT visit looks like.
Right, yeah, that'd be great. I would love that, definitely.
Because I think I try and explain it to everyone on the phone before I see them, but I have an opportunity to do that with my job. But people come in and they're nervous.
Or people don't come in because they're so
they're
nervous. Yeah, exactly. Agreed. I've had plenty of people that have said either they almost didn't come because they didn't know what to expect. And yeah, I think that we could definitely provide that information. Yeah.
Anything else?
No, I think this was great.
Yeah. So thanks for watching.
Yeah, thanks for watching Clits and Coffee. Happy Halloween. We're gonna go pass out some candy now to the trick-or-treaters.
We didn't just dress up for you.
Yeah.